Welcome. In this video, we're diving into a powerful therapy that has changed the lives of thousands of families, occupational therapy with sensory integration, or OT with SI. This approach is especially helpful for children with autism, ADHD, developmental delays, or sensory processing differences. Whether a child struggles with daily tasks like brushing teeth, putting on shoes, or staying calm in noisy places, this video explains what this therapy is, how it works, and how it supports the nervous system. OT with sensory integration is not just a trend. It's backed by decades of experience and is widely used because of the meaningful changes families see in everyday life. How do you know if this therapy is a good fit? If daily routines like brushing hair, getting dressed, or going to school often end in meltdowns, it might be a sign of sensory processing differences. OT with SI gently helps the brain feel safe again, turning overwhelming tasks into more manageable, even enjoyable experiences. What is OT with sensory integration? Occupational therapy helps children develop motor, cognitive, sensory, and social skills for daily life. When combined with sensory integration, OT helps the brain better understand and respond to information from the senses, like touch, sound, sight, movement, and body awareness. When these signals are misinterpreted, they can lead to challenges in behavior, focus, emotions, and learning. OT with SI supports the nervous system to process sensory input in a calmer, more organized way. Why it works, the science behind it. Sensory integration utilizes the brain's natural ability to change, known as neuroplasticity. Through repeated, playful, and structured experiences, the brain can learn new, more effective ways to respond to sensory input. OT uses movement, pressure, and play to help improve emotional regulation, fewer meltdowns, hormone balance, less stress, more calm, social behavior, focus and attention. What is neuroplasticity? Neuroplasticity is the brain's ability to change, adapt, and grow in response to new experiences. Like muscles that get stronger with exercise, the brain builds new pathways when a child repeats therapeutic activities over time. Children with autism, ADHD, or sensory challenges may react in ways that feel overwhelmed or disorganized. But with play-based sensory therapy, the brain can learn to calm overactive responses, strengthen areas needing more stimulation, improve movement, focus, and emotional control, build lasting life skills. Why should parents understand neuroplasticity? When families understand that the brain can grow and adapt, it brings more than just knowledge, it brings hope. OT is not just playtime. It's a structured, purposeful approach designed to help the brain grow. Knowing this helps caregivers stay motivated, celebrate small wins, and trust the process. Why does consistency matter? Change doesn't happen overnight. The brain learns through repetition. Each therapy session builds on the last, like stacking blocks. Even when progress seems slow, small changes begin to show, like sleeping better, tolerating new textures, or making more eye contact. These are signs that the brain is changing. That's why consistency and trust in the process are so important. OT with SI helps the brain discover new ways to feel, move, and connect. With every session, new skills take root and grow. Everyday activities and how OT helps. Brushing teeth involves touch, body awareness, oral sensations, and motor planning. OT helps reduce sensitivity and teaches the brain that this routine is safe and manageable. Getting dressed involves touch, balance, and motor skills. OT gradually helps children tolerate clothing textures, build strength, and coordinate tasks like buttons and zippers. Playing with other kids involves hearing, vision, emotions, and social cues. OT uses play to teach emotional regulation and social interaction, helping children feel calm and connected in group settings.
Sitting still in class
Involves balance, body awareness, sound filtering, and vision. OT creates custom daily routines, called sensory diets, with movement breaks or calming tools to support focus and mood.
Sleeping through the night
Involves body signals and nervous system regulation. OT helps calm the body before bedtime using deep pressure, massage, and calming routines to support restful sleep.
Feeding and trying new foods
Involves taste, smell, touch, and emotional safety. OT introduces food slowly and playfully, helping children become more comfortable with different textures and expand their food variety.
What about sudden laughter in autism?
Unexpected laughter can be a way for the nervous system to process sensory input or emotion. It might seem random, but it often follows a pattern.
OT can help by identifying what triggers the reaction,
teaching emotional regulation strategies,
offering tools for better communication,
creating a sensory plan to support calm and balance. This kind of laughter isn't wrong or bad, it's another way of expressing. With the right support, children can learn to communicate and self-regulate in ways that feel more comfortable and understood.
Common OT equipment for children:
sensory swings, therapy balls, crash pads, weighted blankets or vests, balance boards, scooter boards, climbing walls or ladders, sensory bins, tactile mats or textured surfaces, trampolines, fidget tools, visual timers, resistance bands, body socks, vibrating toys or brushes, oral motor tools, light projectors or bubble tubes, noise-canceling headphones, calming tents or cozy corners, weighted lap pads, sensory pathways, pegboards and fine motor games, bean bags, therapy putty, interactive,
walls or panels.
Every one of these tools serves a purpose, and together, they form a powerful toolkit for sensory integration and brain development.
What you can do today: observe gently.
Pay attention to how a child reacts to touch, sounds, textures, and movement.
Write it down, it helps build a helpful plan. Talk to a pediatrician. Ask for a referral to an occupational therapist.
Look for a therapist trained in sensory integration. OT with sensory integration doesn't try to change a child's identity, it helps them express who they are with less struggle and more joy.
Every small victory is a step forward. Thank you for watching.
If you found this video helpful, please share it with another parent, teacher, or caregiver who may also need it.